Over 1 million individuals receive home care in Canada every year. This number is only going to increase as our population ages. Already, 1 out of every 6 seniors receives home care. Safety at Home, a pan-Canadian home care study, is the first of its kind to examine harmful incidents in home care in Canada and internationally. Dr. Diane Doran from the University of Toronto, along with an extensive team of researchers, have spent the last 2 years studying home care safety.
What we found was that between 10 and 13% of home care clients experience an adverse event on an annual basis.
This percentage represents approximately 130,000 of over 1 million Canadians receiving home care annually who have experienced an adverse event.
We've been receiving home care since Stephanie was first brought home. I think she was probably at that point about 8 weeks old, and we've had nursing in our home ever since.
Denise Clayton's daughter Stephanie suffers serious complex medical conditions and has spent much of her short life in hospital.
We were running 5 IV machines, and she had a G-tube at the time as well. So we spent hours and hours and hours out of our day just doing medical stuff. We had to upgrade all of the electrical in our house to accommodate, because she had to have a fridge in her room. She had to have all this electrical equipment. It's all very complicated work that has to be done in a room with a closed door and a mask in a sterile environment in order to keep her well.
For the vast majority of home care clients, care is safe. But care in the home is getting more complex, and as there are more demands on the caregivers, there is a greater opportunity for harm. The Safety at Home study comes at a much-needed time when the home care sector is growing. From 2008 to 2011, the number of Canadians receiving home care increased 55%. This growth is expected to continue, especially with our increasing aging population.
Safety was a huge concern because Stephanie had a central line. So any contaminant into that line for her would be critical.
The types of adverse events that we observed in this study were falls that resulted in injury, injuries that occurred in the home other than falls, medication-related events, and infections.
She would fall down the stairs constantly. So we think what would happen is she would have bouts of pain when she was just coming down the stairs, and it would throw her gait off. We had to make sure that there were railings everywhere so that if she were falling, she could grab onto something and not hurt herself. I think the only way we got through this was because of our home care. The only, exclusive, 100%, the only way we did this. There's no way I could have done it on my own.
All the nurses that I have pretty much turned into a family because I've gotten used to seeing them every day, and they would all help me a lot.
The Claytons are grateful for their home care hours. When a provider is not around, they have Flair, a COPE service dog who understands 90 commands and is able to assist Stephanie in unsafe situations. The Safety at Home study is expected to help drive policy and practice related to home care safety in Canada and to make home care safer for clients in their homes.
Now that the study is complete, we're working with the Canadian Patient Safety Institute, along with other national organizations such as the Canadian Home Care Association and Accreditation Canada, to really develop policies to ensure a safer home care system, to develop resources and tools for family members, for care providers, for professional care providers.
Information and recommendations from the study will be disseminated over the next several months through presentations, webinars, workshops, guidelines, and other communication strategies. For more information, please visit the Canadian Patient Safety Institute website.